I'd like to introduce Ann. Ann is over 68. She's been a patient for about 20 years and has been on testosterone replacement since May of 2005, which is more than 3.5 years. So what were the problems that led to us checking your testosterone, which we found to be low, and then treating you? What was bothering you?
I felt a lack of energy.
Was that a significant lack of energy?
Yes. And also a lack of strength. And I did go to the gym. I went to the gym regularly. And I still noticed little things that getting out of a bathtub.
Talk a little bit louder. I'm close to the camera and you're not.
Getting out of the bathtub was a problem. I couldn't get up. I had to lean on the tub, and that bothered me. And there were other things.
What about any mental problems with depression or anxiety or anything?
I did have some anxiety, and I did feel depressed at times.
Both?
Both.
Were these a significant amount of anxiety and depression?
Yes.
It was affecting you?
Yes.
Okay. And what about sexually?
There was a lack of libido. I felt like I wasn't interested in sex anymore. And when I did have sex, I had a lot of dryness. Sometimes it was painful.
What about orgasms?
Sometimes I didn't have any orgasms.
And when you did, was it hard to get orgasms? Were they weak or satisfying, or?
They were weak.
So in all the aspects of your sexuality were decreasing?
Yes, I think so.
Okay. When we go back to the time that we checked your testosterone, for how long had all these things been bothering you, approximately?
A long time. A very long time. Maybe 10 years.
10 years. And were they all getting progressively worse or about the same?
About the same. About the same.
Okay. So then we started you on the testosterone in May of 2005, and what was the effect? What was the effect on the energy level and the physical strength?
I noticed right away that the physical strength had improved. I could get up out of the bathtub easily, and I did feel stronger. And I live in a house that has 3 floors, and I go up and down about 100 times a day, and I don't feel tired. I feel good. Before that, I had a problem going up and down stairs. I felt my legs were bothering me, and they don't anymore.
So both the energy and the strength improved?
Yes.
And what about mentally, the anxiety and the depression?
It got better, because I really had no reason to be depressed.
Yes, you did. Testosterone deficiency. Did the depression or the anxiety go away completely, or just get better? And if it just got better, was it a significant improvement?
I think it was a significant improvement.
And that's persisted?
Yes.
Okay. What about the effects on you sexually?
Much better. The libido was much better, and the orgasms were better. The dryness went away.
So it's well lubricated now?
Yes.
You don't have to use anything?
No, nothing.
And the orgasms are easier to get and more intense?
Yes, much better. Night and day.
You had mentioned before that you have a change or an improvement in your sense of self-esteem, your sense of self-confidence?
Yes.
Is that also significant?
I think so. I feel like I look better. And I think that for my age, I feel like I look a lot better than a lot of people that are younger than me.
You noticed some change in the shape of your body?
I did. I think I got a little curvier.
That happens to all women. The belly gets flat and the waist goes in and the buttocks get rounder
true.
again.
Yes.
All those things happen to you.
Yes.
Now, Would you say that all of these improvements you've seen starting 3.5 years ago have persisted up until the present time?
Yes, definitely.
There's been no loss of the effectiveness of the replacement therapy?
No, I don't think so.
Okay,
Well, I feel a lot better.
a lot better. What about side effects?
The only side effect I noticed was facial hair. And
Was that a big problem?
no, it's not really a big problem because all the other benefits, you know.
Yes. I want to tell everybody who's listening to you and watching you that at that time I started women with much higher doses than I currently use. I started you on 100 milligrams every 3 weeks, then went to 80 milligrams. Currently I start women on 20 to 25 milligrams. And at that dose, facial hair is simply not a factor at all. And I know you have much less now than you had at the beginning, and we're still reducing your dosage, so it's going to even decrease even more. And pretty soon you're not going to have any.
Oh, that's good.
But all the other good effects will either stay the same or get even better.
It's very good.
Very good. Okay, I guess that concludes it. Would you have any reservations recommending testosterone replacement to other women?
No, I would like to tell a lot of people to use it. Some people in my family, my sister. I have a friend that I would like to talk to about it, that I'm going to talk to about it.
Okay, very good. You'll be doing them probably the biggest favor of their lives if they're smart enough to listen.
Okay.
Okay.
Thank you.
Thank you so much.